Hello, everyone. Welcome to this talk on the common issues of sexual dysfunction in diabetes. This is put on by Pitt River Health Service, and I'm Theresa Garnero.
And I'm Stephanie Bouquet, and we are both diabetes educators. I'm a registered dietitian, and Theresa is a nurse.
Yeah, so we have you covered. This is a very common issue. Let's define what is sexual dysfunction, because it varies between men and women, and it's something that we see throughout the population who have high sugars. Can you believe that about 70% of women with diabetes are dealing with this issue?
I had no idea. That is crazy. That's very
Yeah,
high.
very high. And for men with diabetes, the main culprit is erectile dysfunction, or ED, as you'll see through our slide deck. They're 3 times more likely to have it, and they get ED 10 years earlier than men who do not have diabetes. It also impacts 40% of men who are 60 years or older. So that's a lot of people. One of the things that is sort of like, as what they call the canary in the mine moment, is for men who have ED, they're more likely to have cardiovascular events. What does that mean?
My assumption is cardiovascular events would be either a heart attack, a stroke, something
Yeah,
that's affecting the vascular system in the body
that's right.
and our heart.
So if the vascular system and the reproductive organs are having issues, then it's also, it speaks to the other blood vessels throughout the body. And the other thing is 1 in 3 men have low testosterone, so that's something to get checked. And why is this? It has to do with the nerve pathways. In one of our previous lectures, Stephanie was mentioning about how the nerves are coated with the myelin sheath. And when the blood sugar levels are high, it could actually affect the communication between the nerves. And so for the nerves going to the sexual organs, it can mean that, our parts don't work as well, and they're not as lubricated as before. You can't function like before. But there are different terms, things to consider with both men and women. So let's jump into it. In terms of women's issues, sexual dysfunction actually is defined as at least 6 months of a lack of motivation for sexual activity, a loss of desire to get anything started, to initiate and participate, and it's personally distressing. For some women over a certain age, it might not be distressing. It might be, you know what, I had fun earlier. So this is the International Society for the Study of Women's Sexual Health definition of sexual dysfunction. And it falls into 2 different categories. There's female cognitive arousal disorder. I mean, these names just go on and on. But basically what this means is an inability to get or maintain mental excitement, like when you're mentally turned on, for at least 6 months, and it is distressing. There's also female genital arousal disorder. So this is that you can't get or maintain that adequate genital response, i.e. lubrication, or because there's sensitivity and pain, for at least 6 months, and it is distressing. A lot of very technical terms and very intimate terms.
But it makes sense that, as you had mentioned, for some females, I mean, this might be okay. These things can happen and I'm okay with it. I'm at a certain age or whatever it may be. But that point, that the mental aspect that is very distressing, that makes a lot of sense to me.
Yeah, and it needs to go on for 6 months, which I hadn't appreciated until I heard about how this was defined. So let's look at, I know it's kind of cheesy to use pink and blue, or is this purple? I'm not sure. But just so you can kind of see the different phases and how women respond versus men, and some of this will not be a big shock. But when we look at the phases of the sexual response, there's first the desire. You have to have a desire to initiate or be interested in. And then there's an arousal stage, and then there's the orgasm stage. Now, for men, it's sort of an on-off. It's like, yeah, I'm interested and ready to go. And for women, it's much more complex. There are many, many components of this. It's sort of like flying a plane. There has to be all these things right in the right place to get where you need to go. So in this talk, we just really wanted to highlight the prevalence, in other words, how common of an issue this is and how often providers and diabetes educators don't ask about this, because we're like looking at blood sugars, we're looking at your blood pressure and your cholesterol. We want to know about your A1C and your carbs and how you're coping with all this. And this sort of falls off the wayside. So providers don't ask, and then patients or people living with diabetes are they don't want to bring it up. And the ones that bring it up, then the providers tend to discuss. But if the provider doesn't bring it up, then most people they won't bring it up. And it is important to bring it up because there are several different kinds of treatment options. I'm not going to read you these drugs, mainly because I can't pronounce them. But
me either, Theresa.
Yeah, perfect. So as you can see on the left-hand side, these are options for women. Of course, biopsychosocial approach is critical, whereas that's not listed for men. You just need you need to find the flip to switch.
Right.
There are medications that work at the central nervous system. Some are approved for premenopause, and then there are some that are used off-label. And there are endocrinologists who are diabetes specialists who really know about the treatment for sexual dysfunction. So if your particular provider isn't well versed in this, you can ask, well, could you send me to somebody who really knows how to prescribe for this? And that will be in your best interest, because if you're distressed about it, then this can help you be less distressed. There's also hormone therapy for post-testosterone. Women have low testosterone levels as well in the postmenopausal phase. Before I jump into some of the options for men, did you have anything you wanted to add here, Stephanie?
The only thing that I agree with you in terms of our rationale for having this talk is just to provide, I think, empowerment and to realize that you're not alone if you're feeling distressed about something like this. This is a natural occurrence in life. And so, to feel confident enough if your doctor is not broaching the subject and it's important to you and a significant other, then I would definitely, feel comfortable bringing some of this up. Bring our slides in. You never know.
Yeah, that's right. And the other thing is, that's not listed here is lubrication. So a lot of the issues in post-menopausal women have to do with dryness, and you can get some of the over-counter lubrication, so it's not a painful experience. Because that's a very common complaint that women have, is that it's painful after going through menopause.
Yes.
That's, assuming that it's like a heterosexual relationship or even same-sex couples, whatever, sometimes lubrication can help.
Yes.
Now, for men, there are different kinds of medications that can help achieve an erection. And of course, this is without having any kind of heart disease, but there are injections. There's a vacuum pump. There's even shockwave therapy. There's implant surgery and testosterone replacement therapy. Again, this is just sort of a broad brush discussion. That little idiom didn't work. I just wanted to have a kind of a larger lens look at, okay, A, it's an issue, B, there's treatment, and C, talk about it. So it does start with communication. It's most likely not going to come from your provider, so it's okay to bring it up. All right, so really thank you for your attention on this. And if you're not being asked about this question and it is distressing for you, definitely discuss it. Any other thoughts, Stephanie?
I think you covered it. Empowerment. Empower yourself.
Yes. Thank you.